to see everyone. I love this group. I think of you guys as deep thinkers. So I haven't had a lot of time to do that because all of my time is controlled by my campaign. So I haven't had a lot of time to reflect on what's happening, but I really loved what you said. The New York Times, I think, today did a first story on our former president and his way of thinking. And people are calling it fantastical, but I don't think it's a fantasy I'd want to live in. But again, my name's Jen Schultz. I teach economics at UMD. I've been working on healthcare reform for over 20 years. I was a state legislator for 8 and working to make our state a great place to live and for people to thrive. And really proud of all the work I did as a state legislator. It was extremely rewarding. The last time I believe I was with this group, we talked a lot about tax exempt status of nonprofit hospitals. And I still think about that, especially now since the city of Duluth is facing a large tax bill on their parking garage. If you haven't aware of this, you can read about it in the paper. But the Minnesota Supreme Court has made some of the clinics that are now owned by Essentia Hospital tax exempt, and it put the city in a difficult position to pay their bonds on the parking garage. But the other thing that I really appreciate is when you say your freedom from is very important to you, freedom from religion. And often we talk about freedom to do something, but a lot rides on this election, freedom from autocracy and dictatorship, and freedom from death because you can't get health care. So it's a great frame that we should also think about besides freedom to do something, freedom from something, not good for us. Today I was asked to talk about Christian nationalism, but I don't know a lot about Christian nationalism or nationalism. I haven't a lot of time to do my homework and give you a really good scoop or hot takes on what my thoughts are on Christian nationalism. What I have been spending a lot of time on is reading about Project 2025 and the Republican Study Committee's budget plan for if Republicans control the U.S. House. And in regards to healthcare, now Project 2025 is a very large manual document, hundreds of pages. I've been really focused on what their plan is for healthcare because that's a passion of mine. And I was going to give you a little brief synopsis of what that plan is in case you don't have time to read all of that document, and the Republican Study Committee's plan, just so you know what they're planning to do next year if they control the U.S. House again. And my takes on that, and then I'm going to open up for Q&A, and you can ask me anything. I recognize this is a 501c3, so we have to be careful not talking about campaigns, and I honor that for sure. But I will tell you there are a lot of Republicans that serve on the Republican Study Committee, including my opponent, and I'm very, very worried about their plan for health care for all of Americans, including people in this district. And since I've been studying healthcare for a long time, I'm even more worried of what their plans are, especially for, I'm sure, how many people here are on Medicare? Okay, how many people here like their Medicare? How many people want to keep their Medicare? Most people are raising their hand for those on Zoom. So Project 2025 is, I would call, the blueprint put together by the Heritage Foundation. This has always been known as a conservative think tank, but they have really become more conservative in my lifetime. And it is a organization that a lot of folks from the former president's administration went to when Biden became president in 2020, sort of like a resting stop where they can get paid. There's a place to go in DC and hang out and lobby other elected officials and put together their plan for the next administration. And apparently there are a lot of Christian nationalists who were involved in writing part of this plan, and that's as much as I'm going to talk about Christian nationalists. But it's definitely a blueprint, a manual for the future. and sort of a guide. And this is the only document that I know of that is public, that is a guide for the next Republican administration. And for Medicare, their plan is to make Medicare Advantage the default option. So you probably know this already, since most of you went through enrollment for Medicare your first time. You get two choices. You can enroll in Medicare Advantage, which is private health insurance that administers the Medicare program, or you can stay in traditional Medicare. And if you stay in traditional Medicare, you can go to any provider you want. There's no limitation in networks. You could go to the Mayo Clinic as long as they accept the Medicare program. Under Medicare Advantage, privatized, you pick a health insurance plan that offers Medicare Advantage, like UCare or United Health Group or Medica, and they have a very narrow network of providers, and you're more limited. And a lot of people pick, does people know if they're on Medicare Advantage? Some people know that they're on Medicare Advantage. Okay, there's a few hands going up. Often people pick a Medicare Advantage plan because it's cheaper, because it comes with the Medicare prescription drug product. Often it covers hospital and physician, Parts A and Part B. And oftentimes the supplemental coverage is included at no or low premium, and there's a lot less cost sharing. The trade-off is that you have a very limited network of providers, and the provider directory could change over time, and you may not be aware of those network changes. And so you could be exposed to more costs if you want to see a certain specialist that is not in the network. Well, this Project 2025 wants to make Medicare Advantage the default plan, that people would be in that plan if they didn't select. They would be in private health care, because their vision is to completely privatize Medicare. And right now, 50% of all Medicare beneficiaries are in a private Medicare Advantage product. And that's really concerning to me, because we're overpaying these private health plans billions and billions of dollars. This was created under Nixon. Economists thought, yeah, let's privatize it. We'll save the federal government taxpayer money. Well, that turns out not to be the case, as places like the Congressional Budget Office, other nonpartisan research universities look at the data, and what's happening in these private health plans are doing what's called upcoding. They are falsifying their data that they send back to the government to make their enrollees look sicker, so they get larger payments from the federal government. And so we're paying billions of dollars every year to these private health plans. We are not saving money for Medicare Advantage. It would have been cheaper for all those individuals to stay in traditional Medicare for the government. So my concern is that they're going to completely privatize it, that you won't have choice, and that you'll be in these very limited, narrow networks of providers, which may not be good for a lot of people who need specialized care. The other big concern is that the Biden-Harris administration passed and signed legislation to reduce expenses for your prescription drugs. So this is the first time they allowed Medicare to negotiate prescription drug prices. They looked at the 10 very expensive, commonly used drugs, and they're negotiating those prices. It's all being litigated, but it's the first time outside the VA system where the government can now negotiate and get volume-based discounts, just like other private sector companies do. We're allowing the government to do the same thing. It's a good thing. We need to add all drugs, negotiate all drugs, and that will happen over time. The second thing that the administration did was cap out-of-pocket spending on drugs, which will be effective in January. You will not pay more than $2,000 for prescription drugs each year. Now, the Project 2025 wants to get rid of those provisions, because those were in the Inflation Reduction Act, and they just talked about repealing the Inflation Reduction Act. That means repealing those programs to get you affordable medication. And they're being lobbied by the pharmaceutical companies. They spend a lot of money doing this. So I'm very worried about the rollback of those. Outside Medicare, there's Medicaid, which covers low-income folks, gets them health insurance throughout the country. A lot of people depend on these programs, and they want to change it into a block grant system. It means they just want to give states a certain amount of money and let states decide how to spend their money on Medicaid. That means states will have the ability to do work requirements or reduce the amount they spend on healthcare for low-income families, kick people off, have a really complicated enrollment system. That is not a good idea if our goal is to make sure everyone has access to healthcare, and it, not based on your ability to pay, not based on income. Reproductive health in Project 2025, very scary. They want to make it really impossible to get access to abortion. They want to implement the Comstock Act. You guys familiar with the Comstock Act? Not allow mifepristone or other drugs to be mailed to individuals that need that drug. And they want to codify the Hyde Amendment. They want to cut federal funding for Planned Parenthood, which provides a lot of healthcare service, not just abortion. And they want to basically take away healthcare from women, and it puts women's lives at risk. And so this trade-off between being against abortion but not being pro-life because it puts women's lives at risk who can't get access to their healthcare is dangerous. And we've seen this happen. We've seen women die because in their state, like Georgia, bans access to abortion and criminalizes physicians for providing necessary health care. And so a lot of physicians are reluctant to do this. Now I'm going to turn to the Republican Study Committee because our former president and Republicans had denied any affiliation with Project 2025. And if you want a good summary of that, there's a website called 25and.me. 25and.me. It's a great summary of the whole Project 2025. You can scroll through it and it's indexed. It's easy to look at different sections. But the Republican Study Committee is an outline, and I'm just going to go through their healthcare reforms, but they want to go back to the days where they think they give people more control by letting you set up your own health savings account, by allowing health insurance companies to charge premiums based on your pre-existing conditions. That means sicker people are going to have to pay more. That means you could get denied health insurance coverage if you have diabetes or asthma, if you have any pre-existing condition. We know that was a complete failure. And that's why we implemented, most people support the Affordable Care Act because we didn't want to have that unfairness of sick people paying more. They also support the Medicaid block grant proposal that's in Project 2025. And they want to, in their Medicare proposal, they want to basically set a benchmark and submit bids from all the Medicare Advantage plans, but have a premium subsidy program that you pick a private health plan and they're going to give you the supplemental assistance, some money to subsidize your premiums, but it's going to be the lowest bid amount. So if you wanted to have the Mayo Clinic in your network, but that plan that has it is very expensive, they're only going to give you a subsidy that's the lowest amount subsidy. You have to pay the difference. So all that does is penalize people who can't afford higher premiums, and it's driving a lot more people into private health plans because the traditional Medicare would not be able to compete in that type of model. So it's a way that they have of basically destroying traditional Medicare and giving you the freedom to pick which provider you want to see. Instead, you only have the freedom to pick the health plan and you'd have to pay the difference. So these are, I'm surprised they're in black and white and they wrote these ideas down. But the problem is when I talk to folks on the phone, and I don't know who I'm calling, I don't know their political affiliation, but they spew back a lot of these talking points from the Fox propaganda channel. I'm worried that they believe that these are not the Republican proposals. And I alone and others, it's very hard to talk to someone who's been given that much propaganda to convince them that what they're hearing is not true. But what is true is the things that are written down and published by these organizations and by the Republican Study Committee. So to me, it's I'm worried about the election, but I'm worried about after the election, and we still have these channels, entertainment, whatever, propaganda channels, and the news media not doing the best job that they could to help educate people. Because you're right, they don't know the difference between what's true and what's false. People have an inability and they're fed this information, and it's just easy to believe that because they don't have to do their own research. They don't have to read the newspapers. A lot of our papers have closed. A lot of them are failing. We don't have as many journalists doing investigative journalism to educate the public. People aren't reading as much. And I'm very worried about our country and our democracy because we're not doing a good enough job educating people on what's true. And the media used to be better at that, and I don't have faith in the media anymore to help educate. And people aren't reading it. People are on social media, and Elon Musk controls part of social media and others for their own self-interest. And that's what keeps me up at night. And regardless of how the election comes out, we still have this problem the next day after the election. How are we going to fix our country? How are we going to make people understand and understand the difference between what's true and false? And our foreign non-allies, I don't know if they're enemies, but there are a lot of other countries that want our democracy to fail, and they're doing a good job polarizing our country and our communities. And we need to talk more about that and how dangerous that is, because once we lose our democracy, it'll be really hard to get it back. Very, very hard if you look to see through history other countries. I'm going to stop there. Thank you for giving me this opportunity to be with you this morning. I don't know how long we have, but I think I can take a few questions. Right? I can take a lot of questions. Yep. I'll summarize the question.
Comment on Medicare cost trends and the original Medicare private insurance has one of the most advantage plans out of pocket matching, and also
Yeah, so the question's a great question. A lot of people in Minnesota have a cost plan, Medicare cost plan. Now, we're grandfathered in to keep selling those. Republicans will likely just not allow that to happen anymore. So you will be forced either in a Medicare Advantage product, and the cost plans will probably be eliminated. That's my sense after reading these plans put out by these organizations and the Republican Study Committee. And we will have very limited influence on what the private health plans, how they structure their products. So right now, let's see, it's October 6th, October 15th, I believe, you're going to find out more about what the plans will offer. And they have warned us that they're going to cut back on their benefits. Like there's a lot of supplemental benefits offered by Medicare Advantage to get you to enroll in those products, like free vision and free dental, and free hearing aids or discounted hearing aids. And they're likely to get rid of some of the things like money for grocery deliveries that some plans offer, or a health club membership. They offer those to get healthy people to enroll in their product. And the people that tend to be sicker stay in traditional Medicare because they want access to all the specialists in those other networks. And so I'm waiting to see what type of products will come out, but I don't have a lot of faith that they're going to keep out-of-pocket maximums that shelter you from saving that money. Barb. Yeah, so this is happening nationwide. The question is about some hospitals are denying, they will not accept payment from Medicare Advantage products. So this is happening in Minnesota, and this is because the Medicare Advantage plans have a very difficult prior authorization. They delay payments to providers, and the providers are like, we're done. You're not paying us what you owe us. Our claims are not being paid on time or ever. And we have to go through this very rigorous prior authorization process to get the care to our patients that they need in a timely way. And so you see this happening across the country. This further limits your network. And a lot of folks are going to have to switch into a new Medicare Advantage plan that hopefully their local hospital is part of that network. So we're going to see a huge change, and it affects over 60,000 Minnesotans this enrollment period. And it's going to continue to happen. So we're going to see a deterioration of our network, provider networks and MA plans. And the problem is you get one chance to make a decision on whether you're going to have Medicare Advantage or traditional when you first become eligible. Because then the premiums for your supplemental Medicare are not based on your health status. You can switch after that one choice later on, but your premiums are going to be based on your health status. You may have to get a medical exam. That exposes you to higher premiums for your supplemental Medicare product. And that's why it would be better now that we're having these problems with MA to allow people to switch and not have your premiums based on your health status for supplemental. We have to change that at the federal level so people can switch back to traditional Medicare. But traditional Medicare has, you're going to probably spend more out of pocket early on when you're healthy and less when you're sick. So that's the trade-off.
I'm a veteran, so I appreciate the health care, and occasionally I go to a private provider, I live up north. I'm a little concerned that they're pulling funding from the Veterans Administration, doubling it into private providers at the expense of the Veterans Administration. I hate to think that my premium health care means starving some other veterans someplace else.
Yeah, so there are many bills at the federal level to fully fund Veterans Affairs and the healthcare system, especially when they passed the PACT Act, which gives veterans coverage for anything they're exposed to, toxins, burn pits, because they served our country and they were exposed to those toxins. And that was a really hard fight to get that passed. And they passed it, but they underestimated the cost. I mean, so many of our military were exposed to these toxins and it's impacting their health that we went through the initial budget for that. And they need like $12 billion more dollars, which was just reappropriated, thank goodness. So hopefully that will keep your access. But when Paul Wellstone was in the Senate, he really fought for veterans to go to private hospitals to get their care because it was more accessible than going down to the VA in Minneapolis. And that program also is underfunded. So I hear your concerns about that access for veterans and how we don't want a two-tier system for veterans. We want all veterans to have access to high-quality health care near their home. I think that is a very, very important thing that we need to fight for in this country. My dad was a Vietnam veteran, and we were very lucky that he had VA health care because he was in hospice at the Minneapolis VA for almost a year. And there's no way and he was not yet eligible for Medicare because he was less than 60. So there's no way my family could have paid for that out of pocket. And so protecting veterans is important. I mean, they're protecting our country and protecting other countries' democracy. The least we could do is give them the health care that they deserve. Charles.
You mentioned earlier systematic uploading.
You can deal with what was the last term? Oh yeah, fraud. Okay, so the question is, tell us more about Medicare upcoding and how we're going to deal with this fraud. Well, CMS will need the resources to look at their data. And right now we're just starting to require the MA private plans to report more information so we can do these audits. The federal government, we can audit their claims. But it's very time intensive. There are not that many forensic accountants out there. Claims data is really messy, and you're looking at millions and millions of claims. I think AI will help us in the future review that data, but to determine whether or not someone has an accurate diagnosis of, let's say, back pain, you have to go check their chart. And so you do these chart reviews too. It's very labor intensive. And so what we need to do is make sure that our agencies have the resources to do those audits, and we do more audits and require the MA plans to submit better data that we can go through in an automatic way using AI, so it's standardized. And that's just starting to happen, but we really just need to change the way we pay, so there are different incentives, so they don't have the incentive to upcode. Change the way we pay these private plans if we're going to keep the private plans in Medicare.
I think the AI suggestion sounded really good, because there are these things like medicine as a whole has some conflicts of interest built in that the person doing the diagnosis typically offers the costly treatment. So I was looking at my own account at St. Luke's portal, and there was a list of conditions I had. One of them was giddiness. That I don't remember having an especially giddy meeting with a physician, but I'm going to have to be more conscious of that when I go in. But it was clear to me that the St. Luke's system has an incentive to upcode, and so that the only way, given the built-in incentives, because they're getting a third-party payer. For me, I would say, look, I don't have giddiness. See how non-giddy I am? And I would not pay it. But CMS is paying it, or they're paying the advantage plans, are paying the healthcare providers who are treating me. So you've got this chain of incentives to upcode. And the only way I can think of to deal with that is the person that's actually writing the checks has to be very careful in monitoring.
Yeah, so those are really good comments about yep, so the providers also have an incentive to upcode, and there's lots of consultants. Like, we spend over $4 trillion in healthcare every year. There's a lot of consultants making a lot of money teaching hospitals and healthcare providers how to maximize their revenue from Medicare and Medicare Advantage plans. And so they're trained how to diagnose and upcode and what to put in the electronic health record so they qualify for higher payments. This is also why places like United Health Group, they're buying physician practices. They are going on a buying spree, health plans, because then they control the chart and the diagnoses, and then they can maximize their revenue. And so we see very few independent clinics. We see a lot of hospitals buying clinics and health insurance plans vertically integrating, and it's very dangerous. And we have been very lax in our Federal Trade Commission and the Department of Justice to review mergers and acquisitions, to look at these healthcare transactions. Now, I'm optimistic that they're getting stronger. They updated the FTC merger guidelines, made them stronger under Lena Khan, who's our FTC commissioner. And she's getting a lot of heat from industry. And they're asking for the administration to, her term just expired after 3 years. And there'll be a lot of pressure on the Senate not to reconfirm her, or for her to step down. That's happening now. So any letters you can write to CMS about keeping Lena Khan as commissioner would be a good thing to do. But they're looking at more mergers and acquisitions. And we in Minnesota gave more authority to our Attorney General's office to look at our transactions. And legislation has passed this year to do more review, require more reporting. And I was just convened a roundtable with national experts for our state legislators so they understand private equity in healthcare, because we see a lot more private equity coming in and buying things like our nursing facilities. They're buying hospitals across the country, and hospitals are closing because they're removing all the assets, stripping all the assets from hospitals. And if you follow the Stewart Hospital case out of Boston, Massachusetts, that's what may happen across the country. And that means communities could be losing their hospital if private equity comes in, strips all the assets, and then you're left with nothing. It's very dangerous, and we need in Minnesota to get ahead of that, but we need to strengthen our federal agencies for oversight of that. And it's also, you need forensic economists and accountants to review what that looks like, because once we do something with private equity, they'll come up with another way to purchase those hospitals outside of private equity guidelines that we set up. So we have to be very broad when we write our legislation to capture all the potential possibilities.
Comment and then a question. Sounds like typical oligarch playbook. Red tape, keep the citizen at a distance from the provider and the source of information. So then my question is to you, I saw on your website you get policy position section it's called, and I'm change the subject to mining. In the groundwater, the rear groundwater. So the position really isn't really quite clear. You seem open to that issue going one direction or the other. So my question is not whether you support it or not, but whether you think it's inevitable that at some point there will be copper nickel mining in that part of the state.
Well, I'm an economist. The question is, what's my position on mining? What do I foresee in the future on mining? And economists are not good at predicting things, so you should never ask them to predict. But we're also saying on one hand and the other. We're trying to take a holistic view of things. And I don't want to predetermine anything on mining. I mean, I've done a lot of homework on mining. I visited most of our mines in Minnesota. I have talked to independent hydrologists and geologists and academics that have no stake in either way, if it goes forward or not. I do know we do have a lot of minerals in the Duluth complex. I do. I do know that we rely on a lot of these minerals. I do know that multinational corporations have not done well mining these minerals in other countries. I do know that our much of the Duluth complex is by water-rich environments, and I do know that we have not yet figured out how to adequately and in a more larger scale remove any potential toxins like sulfate out of the water. What I would do when I'm elected is I would convene a huge stakeholder group and bring everyone to the table, including the 7 tribes, all of the community member representatives, the mining companies, experts that don't have conflicts of interest, to a table, just like we did when we protected the Boundary Waters canoe area. And that was controversial. But we do have to prevent polluting the water. And people in this community know what happens when you put taconite tailings in Lake Superior. And I think we're still dealing with that, with the asbestos fibers and anything else in Lake Superior. And we have to prevent that because there's one thing everyone agrees on, and we cannot pollute our water. Just cannot do it. Everyone agrees. Those that work in mining, those that rely on income from mining, because almost all of our wealth, at least, is in our houses or in our property. And once we pollute the water, we have Flint, Michigan to look at, right? Who's going to want to come and live in this community or buy our home? Our communities will be destroyed. And so I do have faith in technology. And we had Forever Chemicals made by 3M, company in Minnesota, PFAS. You guys heard of PFAS? And a lot of things we buy. Luckily, Minnesota is moving forward on that, boycotting PFAS in our goods. And a scientist has figured out a way to filter out PFAS from water. Thank goodness, because it's in all of our water. It's in our blood. It's on agricultural lands where we get our food because we put sludge from wastewater treatment facilities on farmland. And we're allowing our children to eat toxic food, and it's in their bodies, but they figured out a way to filter it out, and now we have this filtration system that many communities are putting in. It's expensive to filter out PFAS. This is something they thought they could never do, and the scientists figured out how to do it. So do I have faith that we can figure out how to do responsible mining and filter the water adequately? Yes. But if we want to get there, we have to do the research now to do it, and nothing's happening in that front. There's no federal money coming in, being brought in by our elected official at the federal level to give NRI or research institutions the funds they need to do that development. So it's getting litigated in the courts by the tribes. The judges are ruling that it can't happen because it harms the hunting, gathering, fishing rights from the 1854 Treaty of the Tribes, and nothing's going forward. So that's why if people want to do responsible mining, how do we do it? What will it take? It will take all the community to get together, figure out whether we have the technology and the science, fund that, and then move forward and all agree that the technology is sufficient to do responsible mining. That's what has to happen, in my view. And I am optimistic that we can do it and do it better than a multinational corporation. I don't think anyone trusts multinational corporations to do it well because they don't live here. So if we don't trust the multinational corporations to do the mining, who do we trust? Do we trust the state? You know, would we rather have the state do it because the state has a deeper interest in not harming our land and our water and our community members? Maybe we find a different way to structure these contracts with multinational corporations that gives the state and stakeholders more interest in protecting the land. So there's a lot we can do to re-envision how we extract the minerals. But what I would like to see us making things on the Iron Range, like making steel with our taconite, making these iron ore batteries because there's more value there. We keep more of the money in the state than just digging our rock out and sending it to another country for them to add the most value and then sell it back to us. No, we should be making things on the Iron Range, high-paying jobs with good benefits, making things that the whole country and the whole world need to store green energy. These iron ore batteries made with our taconite we've been mining for over 100 years. So that's what I would like to see is actually making final products on the Iron Range.
Last week, listening to the debate, Governor Walz overstated the percentage of fresh water that we have in Minnesota. Quite that much, but it's a lot. In your understanding, are you aware of any other parties who have an eye on Lake Superior fresh water and they want to like take it and refill the Colorado River with it or put it on golf courses in Palm Springs or something like that? And if there is somebody that has an eye there, some way of protecting this resource from willy-nilly use for ridiculous things or some eternal value in our resource.
Yeah, so the question is, Governor Walz may have overstated how much fresh water we have in the state. I don't know the exact number. He said 20%. I don't know. We have a lot of fresh water, and that's because we have Lake Superior. The question is, how are we going to protect that vital resource from being shipped out of our state or being used for things like private corporations? I will tell you, we are depleting our aquifers across this country. Depleting them. People have to drill deeper wells to get to fresh water, especially in places in the southwest of this country. There have been proposals in the past to build a pipeline from Lake Superior through Colorado to California because California needs water to grow a lot of the crops that we depend on, that we eat, and a lot of crops that take a lot of water. Now, I was a Great Lakes Commissioner for 8 years, so I learned a lot about protecting and promoting our Great Lakes and the watershed. And there's a governor compact. Remember when Foxconn in Milwaukee wanted to use north of Milwaukee being proposed? They make TVs, a foreign company. They wanted to use water from Lake Michigan in their production facility. And we thought our Governor Dayton at the time would be the one governor that would say no to that. And he said yes to that. We were all shocked. Do we need Nestle bottling our water from our aquifer and then selling it and making a profit off of municipal water? Probably not a good idea if our aquifers are being depleted, right? Some municipalities in Minnesota are saying no. Some have said yes. Because they're in that situation where they're desperate for jobs or revenue. You shouldn't put them in that position. One by Faribault. But they've been doing it in Michigan for a long time, I believe. So we do want to protect our clean water. I think we're going to, maybe not in my time, but maybe in my children or grandchildren's time, if I have any grandchildren, that we're going to be going to war over water. We're going to be, if climate change, if we don't do anything drastic, there's going to be many parts of this world that aren't inhabitable because of heat. And we're going to see global migration patterns, and that could lead to war too. So we need to be responsible with our water and to protect it, because we can't live without clean water. And we have a lot of it here in Lake Superior, and that's why we might see a lot of migration happening to our district, to our region, because we have access to that clean water. And I always tell people we have good beer because the largest ingredient is our water, and our water is amazing so far, and we do need to protect it. We have to protect it from not being polluted either. And we still have to figure out, what's in our water. Like, does Duluth need a PFAS facility? We need to do that investigation and give the Department of Health and other agencies the ability to test our water and to correct it if there's chemicals in there that are bad for our health, even if they're very diluted.
Know that access to healthcare in Minnesota is big versus losing services like MS services, in a large area, access to reproductive healthcare. They have to drive miles and miles over an hour to get health, and you know that puts their lives at risk. So my question is, and we know that Minnesota sent state delegations to talk with our national representatives about this issue in Minnesota. So my question is, at a federal level, how can we help our rural healthcare in Minnesota?
Great question. The question is, our rural hospitals often are struggling. They're closing needed services, forcing individuals to drive long distances, putting their health at risk, especially women who need maternity care or interventions to protect their fetus, etc. What do we do about it? It's a very good question. I think we're still grappling with what we do when a hospital can't sustain a lot of services just because populations decline. I've been working on healthcare reform. I believe that we need to have federal subsidies directly to our rural hospitals. That relying on programs like 340B or disproportionate share hospital payments, they're just not keeping up with the cost of providing services and attracting the best physicians and other providers, healthcare professionals to these rural communities. We have an amazing program here in Duluth. We have the University of Minnesota Medical School on the Duluth campus. They have been training rural physicians for years and years. It's always a top-rated program. That program needs to be expanded. They did expand rural medical training program, and one is opening in St. Cloud, which is good, but it's still only a few seats. We need to train more physicians and medical practitioners who are willing to locate in rural areas. And we need the federal government to step up and directly subsidize healthcare in rural communities so people don't have to drive an hour. And it's not just certain services at hospitals, it's like dental care. I was just talking to a man from Cook, and he would drive all the way to Two Harbors to get his dental care. A lot of folks don't even have vehicles or maybe the gas money to make that drive. And dental care is really vital for a person's health because they need to eat healthy. If their teeth are rotting or in bad shape, they can't eat healthy. So it's a big problem. The other problem we have, like you mentioned, Barb, is that ground ambulance. A lot of communities can't afford their ground ambulance or EMS. And the easy solution to that is to allow Medicare to reimburse for non-transfers, meaning that the ambulance shows up at someone who needs help, but that doesn't result in a transportation to a hospital, but the EMS staff are helping that person. They should get reimbursed for that service from Medicare and other programs. So that is an easy solution to help fund ground ambulance. We might need to do other things, but I was talking to a mayor in a small community on the Iron Range, and what they resorted to was having 2 ambulances because they would get reimbursed the most if they transferred patients from their community to Duluth or the Twin Cities. That transport reimburses much more, but if you only have 1 ambulance, you can't do that because then your ambulance is in the Twin Cities, and who's going to respond to the emergency in your community? So a lot of communities just can't afford 2 ambulances and 2 teams of EMS staff or volunteers. So we have to make sure that they can cover their expenses, and the state just doesn't have all of the resources to do that. We have to, at the state level, balance our budget. That's why we need federal help. And this is true across the country, ground ambulance. When I was in Monoman, their one hospital had to go to emergency only hospital, and they have 6 to 8 air ambulance visits a day because they can't staff, they don't have the resources to be a full service hospital. That's expensive, air ambulance, when you take a helicopter. And that many times a day is very expensive. We need to figure out how can we get hospitals like that to cover more services for people in their community. Because when employers look to see where do we want to expand or relocate, they're going to look for communities with good health care, good schools, right, and housing. Those are all things we're struggling with right now. And so if we want people to move into the 8th district, we need to make sure our communities have those types of services and they're strong. We'll take that, Mike.
Living in Superior, the plan now is to tear down the high bridge and then build a new one. Is that going to necessitate more air ambulance because they're not going to have time to ambulance someone over the long bridge?
So the question is, when we tear down the bridge and we only have one bridge that connects Superior to Duluth, is that going to slow ambulance service? Will they have to use air ambulance? It's a great question. I don't know the answer to that. I don't know the answer. I'm going to guess it still might be faster to be ground ambulance than to do a helicopter, but we do have a lot of helicopter services in our community. I don't know if we're going to see more traffic. There's going to be more traffic. Will it be backed up? I don't know. At certain times of the day, maybe.
I think the ship has already sailed. They're going to tear down the old bridge and then start on the new, rather than doing side by side. So going to inconvenience transportation for longer.
Yeah, that would be a good question for you to have someone from the Minnesota Department of Transportation come and ask. And we have a great representative in Duluth who would be able to answer that question. I believe they probably considered that when they're deciding what to do, in what order, but I don't know the answer to that. Yeah.
2 quick questions. One is, I have a colleague who cites an alarming figure about how much of healthcare dollars are spent on the last 6 months of life. And if that money would move to all the rest of life, the system would not have to, the system would be less expensive. And I just would like to know your thoughts on that. Second question is, I corresponded with the dean of our vet school at UND about what determined how many slots they offered. She said she got allocated from the cities, whatever we didn't argue. And then I looked online and it said that the number of physicians is in effect capped by CMS that pays for the residencies in the hospitals. And that there had been a worry about overproduction of physicians 10, 15 years ago. So they either capped it or they reduced it, and it's never changed since then. Does that accord with your understanding?
Yeah, so the question is about what's the barrier to increasing the number of trained medical professionals? Is it the education programs that limit the number of seats, or is it something else? It is. So we do pay for graduate medical education, and Medicare pays for some of this. And it is limited to a number of residency slots. We don't have enough residency slots to train more physicians. It is a cost to the hospitals that run these programs. They need to get reimbursed more. So yes, the federal government can increase the number of residency slots they subsidize, they pay for. That should solve part of the problem. And then it's very expensive to add more seats in classrooms, or have to build new classrooms to have expanding cohorts of medical professionals. That also needs to happen. We've seen a record number of medical professionals retire after the pandemic. They got burned out. A lot of them are burned out on the corporatization of medicine, that they can't see their physicians or patients for more than 15 minutes or 20 minutes. They are really burned out, and it's not the profession that they knew when they went into it. It's changing, and they don't like how it's changing, and so they're retiring. And we see fewer people who can afford to go to expensive dental school or medical school. So that's also a barrier. So all of those things need to be corrected, and a lot of people are well aware, as I am, about those barriers. Yep, and it's a lot of it is a lack of residencies, and some hospitals have ended their residency programs because they can no longer help subsidize it because the federal government hasn't kept up with the cost of training medical students.
You know, for me, all this underscores the insidious philosophy of the GOP and their, make the government so small you can drown it in the bathtub. It's really terrible.
Yeah, when I was a state legislator, it was really frustrating to have my Republican colleagues stand up and rail and complain about government being intrusive, being making our lives more difficult. But they're part, they run for office. They are part of the government. What I realized when I was elected is how wonderful the people who work for our state are, how amazing our bureaucrats are. I mean, they just devote themselves to working on our behalf to make our state the best it is, and they don't get paid well. They work long hours during session. They are there as long as we are. It's day, night, weekends. They are just exhausted after session. And our state is known for having just amazing folks that work for state agencies. And this is well known in other states. They compare us to them, and they're just jealous. So I realized how wonderful the folks that work for our state are, and I think if more Republicans would recognize that and understand it, but it is frustrating that people forget how important government is in our daily lives. We could not function without government. The biggest role of government is to redistribute wealth. Who would do that? Who would do that? Who would provide our roads and our bridges and our healthcare services, right? It would be impossible to have commerce, right? Money supply, right? Having faith in our currency. We need the government, not, just above rule of law and order. I'm a little worried about that. About the rule of law and having a president that is above the law. It's scary. But it's our job, as American citizens, to remind people the role of the government and how much we rely on it so we can push back. I don't think we push back on that argument that the government is bad. And, it probably started well before Reagan, but that in my lifetime, I remember Reagan, really complaining about the role of government. And government is too big. Right.
From the government on here to help you.
Mm-hmm.
So if you believe government is bad, the solution is not to get rid of it. The solution is to have better government.
That's right. Have better government, stronger government that makes others accountable. We don't talk about corporations and their fraud and their waste and their abuse, right? We need to know corporate welfare. We've got people working at Walmart who qualify for our public programs because Walmart doesn't pay living wages with good benefits. That is corporate welfare. And we need to remind folks that, complain about helping students get an education and they're taking on all this debt. When we give, billions of dollars to private contractors for military things, right? We need to really figure out what our priorities are as a country and remind people how great our democracy is, and we don't want to lose it. And it takes a strong government that's functioning to protect our democracy and all of our freedom, independence, and liberty. But it is on us to have those conversations and tell people the role of government, especially young people, about the role of government. I guess we're just not doing a great job in our civics classes in educating young people too about the role of government.
Thanks for coming this morning. I just returned from several weeks in Germany and Sweden, and I traveled by train the whole time. And I got to speak with lots of people, and I did spend a couple of weeks with my cousin in Sweden. Three very interesting observations
almost to a person. The first one was, what's the former president of 45? They just cannot fathom what's going on. But at the same time, they were talking about eating cats and dogs. Second one is the healthcare. And as we probably all know here, most European picture. Third thing which I thought was very interesting was they understand the electoral college better than our people do, and they just could not figure out how that can, and our explanation of public versus democracy, how that works. I don't know if you want to touch on any of that or not.
Let me try to summarize that for those on Zoom. Traveling to other countries like Sweden, other European countries, they have questioned how people can support our former president again, especially after saying things about legal migrants eating cats and dogs, which is not true. And number two, they have amazing health care in other developed countries. And why can't we have the same in our country? And what was the third one again? The electoral college. A lot of folks in other countries understand our electoral college system better. And I do hear, taking number 3 first, I do hear a lot of people that want to reform our electoral college. Because if you win by the popular vote, you should win, right? And that's complicated to open that up. I don't think our country's in a good state right now to have the states convene a convention. I'm just saying, I don't know what would happen if we do that. I think it needs to happen. We need reform. Number 2, we should have the best health care. We're the richest developed country, and we should make sure everyone has a right to health care. And it should not be based on your income. So we need to get there. It's a slow process. The ACA was the biggest healthcare reform since 1965 when Medicare and Medicaid passed. And we've got to build off of what we have. Number 1, I'm still trying to figure out. I mean, I think people supported our former president again because they're being told different things in propaganda and being misled about he's going to protect all women, so we don't have to work ever again, and we're going to be safe, and it's paternalistic notion that he's going to be the savior for a lot of people in this country. They really believe that because people are really struggling. And I forgot who under Hitler said this, but if you're going to lie, tell big lies. And he's telling big lies, and people are believing them. And that includes that he won in 2020, which he did not. And when I'm on the phone with individuals that believe the system is rigged against them. A lot of folks feel that the system is completely rigged because they're struggling and they're being neglected. That's real. That is real. There's a lot of poverty in our district. A lot of people are still struggling, and but at the same time, they don't want the government to help them either. They want tax fairness. They want to be able to afford their home or buy a home. They want their kids to be able to find a job in the 8th district. So we have to acknowledge that they're struggling and listen to their concerns and figure out how are we going to go forward so everyone thrives. But they really believe that the former president is going to be their savior and is going to fix everything. And I think reminding people of those 4 years that people endured, and if he was going to fix things, why didn't he do it then? Why didn't he build the wall then? Why didn't he have border security reform then? And people blame a lot of stuff on presidents, but I'll tell you, just go back to Schoolhouse Rock and how a bill becomes a law. It starts in Congress. The president gets to sign or veto. The bill has to show up on their desk. Just remind people that, because my opponent and others are going to just bash the current presidential administration and blame everything on them. And you just don't do that. I was at Proctor High School all day on Monday, and A lot of the students had wonderful questions, but they talked, you know, a lot of I asked them what their biggest concern was. I heard a lot about gas prices. Because they have limited income, they're almost all working part-time jobs, going to school full-time. And that's one thing they have to spend money on is gas to get to their job. And so that's really at the forefront, but that was the most common response. Other things were gun violence and climate change and affording higher education and training, et cetera. But, and they were convinced that the president was to blame for gas prices. And I have to remind, you know, I reminded them that the president is not setting prices of anything. You know, Republicans would hate government to set prices, right? And that we're drilling more now more than ever before to increase the supply. But there's consolidation, concentration in the fossil fuel industry. Only a few companies are in control, and they can price gouge and set prices wherever they want to set prices at and take the profit, and that's what we see happening. And so a lot of people, even young people, are kind of misinformed about the power of the president. And people often don't blame the free market. And it's not really free when only a few folks control all the prices. And that's true in many industries: fossil fuel, healthcare, ag. Really, farmers are being squeezed because their inputs are so high because there's only one company supplying them products to grow or to feed stock. So it's a big, big problem that we have allowed to happen in this country. And that a lot has to do with how much power is and how much money is in politics. We protect these companies. Politicians protect those companies because they're paying for their campaigns. And that has to change. People ask us the first thing you're doing, what will be the first thing you do after you're elected? Is we need campaign finance reform, right? Or I can't do anything. You got to take the money out of politics. Okay, Mike, did you have a quick question or comment?
Well, talking about the economy, you used to go to the newspaper to find these ads, but to go look for a job, so many jobs are around $15 an hour, $30,000 a year. Then you go, okay, now I need a place to live. And you look at the rents. And rent now in town costs a lot of people about it would cost about 2/3 of their take home. And rule of thumb, you're only supposed to pay about 1/3 of your take home. So the economy as far as rent and job, what you pay for your job are all that.
Yeah, good comment. Mike's pointing out that our economy is not working for a large percent of our population. The economy is not working because people's wages aren't keeping up with the cost of living, including the cost of housing, which can be 2/3 as much as your salary or wages, income, and that's not sustainable because half of your wages, if you get employer-sponsored insurance, could be going to healthcare. Also not sustainable. It's eating away at our salaries, our wages, is housing and healthcare. And then all the other things, utility, gas, right, groceries, and childcare. Childcare is as much as a year of college tuition, not affordable. And we have childcare facilities closing across the state and country. And then what happens? Then you can have, if there are two parents at home that want to work, one might have to stay home, and you lose out on that income if you can't find childcare. So yeah, families are really struggling, and we need to make sure folks are paying living wages and that they're not sending that profit back to their shareholders. And the billionaires keep getting more higher percentage of our increase in productivity. The wealth we create is mostly going to the top 1% of the population. And that's what people need to realize, and that's where things are unfair. So fixing the tax system, expanding the child tax credit and the child care independent tax credit. There's a lot we can do to make the tax system more fair so working families aren't paying the highest of taxes and redistribute wealth, just like what the biggest role of government is to redistribute wealth. So I gotta go kick off the door knock and then go to another event in Aiken, but it's been great to be here. I think that there's 29 more days. I wish the election were tomorrow, but I will sleep after the election, not when I'm dead. But I really appreciate you gathering together and to be a community. It's so important for everyone. to have each other and to have the social bond and support one another. We really need that. We need that more than ever. And I hope you extend that to other folks, even though they may not think like us or have different ideology. Just have a lot of compassion and empathy. As I know Gloria Steinem used to always say this, my mom's hero, is that if we had more empathy in the world, we would all be much better off. And I know you guys practice that every day. Please continue to do that. Really great to be with you. Sorry I couldn't talk about Christian nationalism more, but I'm going to stick to my bread and butter healthcare when my time is not my own. I'll come back and talk about that later after the election maybe. But thanks again for having me. Really appreciate it. Have a wonderful rest of your day.